name is Ava Hall, and today I will be discussing digital manipulation as a voice facilitating approach in voice therapy. These techniques can be used for a variety of populations, and I hope that you find them helpful. For example, males, particularly those who remain prepubescent, whose voice is a little bit too high, can use the mode of nudging the thyroid cartilage back slightly to shorten the length of vocal folds, resulting in a lower voice. Another form of digital manipulation is used for monitoring. Have the client sing a high note so that the larynx rises, or sing a low note while relaxed. This is a good method for the client to monitor the height of laryngeal movement or note the posture of the larynx. Digital manipulation is also beneficial for those who have vocal fold paralysis, either typically unilateral vocal fold paralysis. And for this, it's helpful to place your fingers on the lateral thyroid cartilages to facilitate vocal fold approximation. I'm going to dive a little bit deeper in these techniques in this next section. So there are three main digital procedures. The first digital procedure is digital pressure for lowering pitch. I explained that a little bit earlier with prepubescent males whose voice is a little bit too high and who we hope to help them lower their voice. This can be done by having the client prolong a vowel, such as ah or e, and by placing pressure on the thyroid cartilage as they're doing that. Practice that a few times, and then have the client maintain the lower pitch after the fingers are removed. So once you've achieved that lower pitch by maintaining pressure on the thyroid, remove your fingers and have them try to prolong that vowel. After they've successfully completed this, have the client practice producing that low pitch with and without digital pressure. The second digital procedure is monitoring the vertical movements of the larynx. This is particularly beneficial for individuals who need to monitor their thyroid elevation. So have the client place their own hands on the thyroid and monitor the vertical movements while phonating. Have the client produce a pitch a few notes off of the lowest end of his range, so not the lowest pitch that he can achieve, but a little bit higher than that. And then have the client, with each note that is played, lower his voice until he can't lower it anymore while he is monitoring it with his own fingers. Once the client has reached the lowest note, have the client sing one note. Have the client sing the highest note that he can, so go up in notes until he's reached the highest pitch range that he can achieve. And that way that he's monitoring how high and how low his larynx is going. Afterwards, discuss the voice free of strain and with no laryngeal movement. So try to have them read a book and to monitor their own laryngeal elevation, and have try to discuss the differences between a poor vocal quality and a good vocal quality as they're reading, or after they're reading, and as they're noticing their laryngeal elevation. Finally, digital manipulation is also very beneficial for individuals who have, for unilateral digital pressure, for patients with unilateral vocal fold paralysis. So for this exercise, have the patient tilt his head slightly forward and have the client sustain a vowel. While he or she is doing that, exert pressure on the lateral thyroid on the side of the vocal paralysis, and just kind of practice by phonating. If this doesn't work, try applying pressure on the opposite side of the paralysis. And if that still doesn't work, try turning the head to one side. If you turn the head to the left, apply pressure on the left side. If that doesn't help, then apply pressure on the right side while the head is still tilted left. Finally, if all this still doesn't really work or improve the quality of the voice, turn the head to the right with each side pressed till a more functional voice occurs. Now, why are all of these approaches beneficial? Well, they're beneficial because they they're easy to assess. For example, either anterior digital pressure will lower the pitch or it won't. If it does work, it serves as a window of opportunity for the patient to continue to practice that. Monitoring laryngeal elevation is beneficial in helping the client realize how much unnecessary laryngeal movement he or she may be exerting. And then finally, applying digital pressure to an individual with vocal fold paralysis may contribute towards a more functional voice. This may also make clients aware perhaps of surgical procedures needed to gain a more functional voice. Thank you for watching this video. I hope you learned something new about digital manipulation. Thank you.